I'm Dr. Shirish Hiremath. I'm the Director of Cath Lab at Ruby Hall in Pune. Clearly, in India especially, the multivessel disease is growing rapidly. This is primarily because the Indians get the disease at a younger age. So if somebody picks it up at age 35 or 40, by the time he gets to 80, it's always going to be multivessel disease. So clearly it's something which is very important for this country. Yes, when we talk of coronary artery disease, we always have three important options. Do aggressive, good medical therapy. Alternatively, you have to do an intervention which may be in terms of an angioplasty or a bypass surgery. All are important. Generally, I would imagine that when you sit in a car, you put your seat belt. So that's like taking aggressive medical therapy and continuing. But when an event happens, the airbags come out. So the angioplasty or a bypass surgery is like an emergency measure where artery or a person who is on a downward trend comes out very effectively and is ready to live an effective life subsequently. As an intervention cardiologist, this is something which is extremely important. Patient has lots of questions. They would obviously want to have the least traumatic kind of a therapy to them. So the surgeons are now moving from a regular surgery to a mini-cut surgery or micro-invasive surgery. And we as angioplasters, we never cut anything, no stitch when we do an angioplasty procedure. We are also spreading our wings to multivessel disease, complex coronary angioplasties. So for this, you need a good support. So initially, like say, we used to have an aortic balloon pump for somebody who had low blood pressure. Today, we have another few devices like Impella, which make life very easy for an angioplaster to give effective results. More importantly, a conventional angioplasty can be perfected by doing some kind of testing at the end of the procedure. This can be done at the beginning of the procedure and repeated at the end of the procedures. So we are talking of IVUS or OCT, and this is to decide what kind of therapy we should be using. We have multiple options. It's not anymore just balloon and stent, but it could be balloon, a cutting balloon, or scoring balloon, a shockwave balloon, or a high pressure non-compliant balloon, and so on. And also there are procedures which soften a hardened vessel, which is so very crucial for a good stent placement. So all these techniques can be implemented in a given case according to the need, and this is brought out by imaging before. Imaging at the end of the procedure tells you that whether your stent is very effectively placed in a vessel, the result is acceptable, and it will go for years and years very effectively. So either ways, the patient gains substantially with combination of imaging and physiology. Absolutely. I mean, if you see the evolution of angioplasty world over and in India we started doing angioplasty in 1987. So it's almost 3 decades of angioplasty in India. And we clearly realized the way we were doing in the early years and the way we do it today, the newer technology has clearly benefited. We are so confident. In fact, this debate comes up when we talk of the comparison for multivessel disease between bypass surgery on one side and angioplasty on the other side. So we have this syntax study earlier, which clearly indicated that if you have a high syntax score or a moderate syntax score, surgery is better. Same syntax a few years later was done as syntax 2, in which a lot of physiology was used and a lot of imaging was used. And that clearly shows that the angioplasty results can be very close to the surgical results. So this is the kind of gain that we have gained while perfecting the angioplasty with imaging and physiology. No, I would not give this choice to the patient. Clearly, when I'm talking to patient and his family, what kind of stents, we tell them that this is available to you. And I clearly tell them that no one stent is the best in the world for everybody. So it depends a lot on what kind of linear strength that you need from the stent, what kind of tortuosities through which the stent has to go. So it's the bed which is simple or difficult. The stent performance can change. So we always take a lot of effort to create a good bed for the stent to land. So today's stents, they perform very well. The deliverability is of course very important, and this is where the stents have improved a great deal. So not only the stent thickness, but the shaft, the way the stent is crimped on the balloon, everything has changed. So the stents are getting easier and easier to deliver. Also, we have techniques like guide catheter extension, which can help you to take a stent to a correct location relatively easily. And that's how the stent delivery is not anymore an issue. However, the stent will have its own sort of specifications which make them run for longer years. And this is where I would feel, I tell the patients that this particular stent has this much documentation, this much data, and this is why it's going to be my choice for your case. But it would change from person to person and patient to patient.